I am Dr. Afan, and this video is intended for resident physicians or pediatric trainees who are preparing for their examination. The purpose of this video is to teach the trainee doctors how to perform a general physical examination, especially in a pediatric patient. The first thing that you should remember is that whenever you start the general physical examination, it should be done in all three postures: lying posture, sitting posture, and standing posture. In this way, you won't miss any important finding. So, suppose the patient is lying on a couch or on a bed. You will start with the hands, and because the time is limited, it is a good practice to start with the vitals. I prefer to start with the vitals because even when you are going along a specific scheme of starting from the nails, going towards the head, and finishing at the toes, there are chances that you will miss the vitals. So if you start with the vitals, you will manage your time and you won't miss these important examination findings. So in the beginning, place a thermometer under the underarm and start recording the pulse rate. 30 seconds for the pulse rate, 30 seconds for the respiratory rate. And while you're recording the respiratory rate, it is a good idea to keep your fingers on the pulse so that the patient is not apprehensive and changes his rhythm voluntarily of breathing. By the end of and afterwards, monitor the blood pressure of the patient. Even in pediatric patients, especially patients who are above 6 years of age, it is a good practice to record the blood pressure as well. I'll mention here that to record the blood pressure, you should use the appropriate size cup. And after recording the blood pressure, take out the thermometer and record the temperature. This whole process will take you around 1.5 minutes at maximum. Then look at the nails of both the hands. Whatever things are impaired in the body, compare them at the same time. So lay both hands in front of you and examine the nails of both the hands. You will look for pallor, koilonychia, clubbing, cyanosis, pitting, splinter hemorrhages in the nails. And at the back of the palm, you can look for scratch marks that can be seen in patients with special skin conditions or jaundice. You can also look for the wasting of the muscles, of the interosseous muscles. And also keenly observe the proximal and distal interpharyngeal joints, because many of the problems of the joints, especially juvenile idiopathic arthritis, can be picked by abnormalities of these joints. Then when you flip the hands, look at the palms. Look at the palms for pallor, for wasting of the thenar and hypothenar muscles, for any sweating that can be a sign of anxiety or hypothyroidism, and also to check for the tremors of the fingers. Then moving up, you have already checked the pulse, so you will look at the forearm for any rashes, any discoloration, any scratch marks, any surgical marks, things like that. You will also observe the elbow joint and the epitrochlear lymph node. Then moving upwards, you will look for the same things in the skin of the arm. And the important thing, especially in the pediatric population, and especially in our setup of the subcontinent region, as tuberculosis is prevalent and BCG vaccine is mandatory in many countries of the subcontinent region. So you should look for the BCG scar mark at the right deltoid. In Pakistan it is the right deltoid, in other countries it may be inoculated on the left shoulder. Afterwards, you should examine the axillary lymph nodes. You should know the technique of examining the axillary lymph nodes. If you are examining the right side of the patient, you will use your left hand to check for the anterior, medial and apical lymph nodes, and for the lateral chain you will switch your hands and use the right hand. I'll repeat, you will use your left hand for the right anterior, medial and apical groups, and right hand for the lateral group. And for the posterior chain, you can stand behind the patient and examine both the posterior chains or one by one. Whenever you are examining the axillary lymph nodes, it is a better idea to use the relevant muscle as a base. For example, for the anterior chain, you should use pectoralis major muscle as a base and feel the lymph nodes against that muscle. For the posterior, latissimus dorsi. For the medial chain, the rib cage. For the lateral chain, the humerus. And for the apical chain, you have to relax the axillary roof musculature, and for that you have to adduct the arm fully. I will try to demonstrate these steps practically on one of the patients in my coming videos, inshallah. After the lymph nodes, go up, examine the hair, the texture of the hair, the color of the hair, if the hair are easily pluckable, any loss of hair, any infection or bogginess of the scalp. You should observe all these things. Have a general view of the face of the patient. If a patient is having syndromic features, many of the features can be seen on the face. Afterwards, check each eye, check the palpebral conjunctiva, bulbar conjunctiva, and if you have time at the end, you can offer fundoscopic examination. Check for jaundice. For jaundice, you should tell the examiner that you want to take the patient and check for jaundice in this daylight sunlight. Do anterior rhinoscopy. Check both the nostrils. Check the ears. If you have an otoscope, you can use the otoscope. Otherwise, you can use a pen light to have a general view of the external auditory meatus. Look inside the oral cavity. Look at the teeth, the oral dental hygiene, the tongue, for any fissures, for any loss of papilla, the back of the throat. Sometimes cleft palate can be seen in the pediatric population. Afterwards, come down, look at the neck. The cervical lymph node examination is extremely important as well. You should check all the lymph nodes. You will be standing behind the patient. Submental, submandibular, preauricular, postauricular, anterior cervical chain, supraclavicular and posterior cervical chain, and at the end occipital. This is the usual technique that is followed. You should keenly check each group of lymph node. Look for swelling of the thyroid on the neck. For obese patients, especially in the adolescent age group, you should also look at the back of the neck for any acanthosis nigricans. Afterwards, have a general view of the chest of the patient. In female patients who are in the adolescent age group, you should also comment on the sexual maturity rating as well. Have a general look at the tummy of the patient, and have a general look at the groin, the genitalia. Genitalia is very important. Sometimes pediatric patients present with disorder of sexual development, and if you do not look at the genitalia, then you might miss these findings. To expose the patient, you should take into consideration and take all the measures to ensure the privacy of your patient. Look at the legs, the knee joints, the hip joints, the feet. You should especially look for pitting pedal edema as well. Afterwards, you will ask the patient to sit up, and when the patient is one more thing, when the patient was lying in the groin, you will check for inguinal lymph nodes as well. For any hernial orifices, you will ask the patient to strain or cuff, and you will look for hernial orifices as well. When afterwards, ask the patient to sit. When the patient is sitting, have a general look at the back of the patient. If there is any obvious abnormality in the form of deviation of the spine, then you might want to palpate each vertebral spine individually. And also look for the sacral edema as well. Then you will ask the patient to stand up and ask him to walk and observe the gait of the patient. Many a times you will pick many neurological findings when the patient is walking. And remember one thing, for the pediatric patients, when the patient is standing, you should check the weight of the patient, the height of the patient, or if the patient is unable to stand, the length of the patient, and the occipitofrontal circumference of the patient. If you will perform all these things, you will be able to complete your general physical examination and hopefully will not miss any obvious finding. So this is all for today's video. In my coming videos, I will teach you how to compile your findings and how to explain your case in front of the examiner. If you will use this technique that I have mentioned for the general physical examination, you will be able to complete your examination in 4 to 4.5 minutes, and you will have the remaining 30 seconds to gather your thoughts and prepare yourself to brief your case. And at the end, always thank the patient. Always, if you have uncovered him, cover him up. And when you're describing your case to the examiner, don't adopt the habit of looking back at the patient and then looking back at the examiner and telling him the findings. Then after you have completed your examination, thank the patient, cover him, and then look at the examiner directly into the eyes and describe your case without looking back at the patient.